Okay, thank you very much. Thank you everyone. Thank you for inviting me to the conference and a lot of reflection about PCD. I will try to communicate with you some advice on iris clearance techniques. First of all, I have to say one thing, that we have a lot and very powerful tools for all peoples that need iris clearance techniques, cystic fibrosis, neuromuscular disease. And now we know that all these tools are really very, very important, and they works very well. And why we cannot say that works very well also in PCD patients in everyday life. Also in some disease, very, very important disease, like cystic fibrosis, and some patients that have two very rare disease that works well. And we know that iris clearance techniques works in the modern era of modulator. This is our patients that had modulators with cystic fibrosis and didn't do iris clearance techniques because she said, I'm okay with my modulators and I don't want to do more my physio. Just 3 months without iris clearance techniques and modulator, she had a very severe atelectasis. She started again physiotherapy, a positive expiratory pressure or IPV, and his lungs works again. Another thing that I would like to say is the importance of lung function test. Lung function test is important to see a lot of sides of disease or lung disease, but now classic lung function test, maybe it's not enough. Iris clearance techniques helps now to change the epidemiology of a lot of disease, a lot of rare disease and severity disease. This is why we have been able to have a toolbox expansion. Our toolbox is the result of a worldwide action strategy and people that also now are working very well with proof of concept of physiology and with a lot of tools. Every tools have indication, every tools can help now in this year to reduce the burden and to help the efficacy of also of these tools. But now it's very important, sorry for my English, it's very important to try to look at the complexity, not only at diagnosis of a patient, the complexity of the system. This is our ability to look at the proof of concept of every device, to see inside the patient, and why not to see the evidence, but not only the evidence. Now we have in bibliography a lot of paper that doesn't help physio, it does help people to make a choice, to make a good choice for the tools that we must choose in everyday life. So complex scenarios like this need more analytical models. But can we have an analytical mood on iris clearance techniques? The answer is yes, because now we have the possibility to look not only to the quantity of the tools of iris clearance techniques, but to look of the quality. Every techniques I can check, every techniques proof of concept. When people come to me for the physio, I know, okay, I would like to work with the positive expiratory pressure max, for example, or OPEP or a cappella. I know, if I know the proof of concept, I know exactly how the patient, that people must do. the PEP in the correct way. But when the patient is at home, we don't know what happens at home. And now it's possible to have a correct and perfect and precise analysis of what everything do the patient with the device or the tool. This is a wonderful experience that make the group of Professor Eleanor Main in UK that has been able to analyze in a short time 715 breaths over 1,800 ACT treatments in a short period, and say and look for every treatment, for every patient, how was the quality. And now we have the possibility to do this. It's not impossible, it's not very expensive, just look at the project. And now we have the possibility also to look with precision. Now we talk every day precision medicine, now we can have precision physiotherapy and precision possibility to see that patients that do physiotherapy in correct way also can have a better for one over the time. I go forward because the shortest time. So we can say also for PCD patients and PCD patients doing airway screening techniques, that good quality breathing can be a better efficacy and sure no great burnout for the techniques. Also we have to think that some devices behavior can facilitate better than others, and now we can calculate if that device is good for that patient or no good. Another experience very, very important of the group of Chatburn in the United States say us, for example, that oscillatory device have very strict characteristics, and we can check on that patient the best device for that patient. I think that now I can stop my presentation and go to the discussion. Thank you very much.